Does taking a biopsy of embryos in genetic screening damage the embryos? So let's look at what this study said. When couples use IVF for genetic screening of embryos, this involves taking a small sample of cells from an embryo where it reaches the blastocyst stage for testing and see whether it is genetically normal or not before it can be implanted. Understandingly, many patients and professionals often ask this question: will the embryo be damaged? By removing cells, does it reduce the chance of pregnancy and turning into a healthy baby? To answer this question, a research team at Peking University reviewed 850 cases where embryos underwent genetic screening for a single PGT-M, single gene monogenic diseases over an 11-year period. They divided embryos into four groups based on how many cells were sampled, from just 1 to 5 to way more than 15 cells. They then tracked whether these embryos would lead to a positive pregnancy test, clinical pregnancies, and most importantly, live births. The key findings were clear. The number of cells taken during biopsy had no significant effect on pregnancy or live birth rates, regardless of whether the embryos had as few as one or as many as 15 cells biopsied. Success rates were similar between 43 to 50%. The qualities that mattered more were the conditions and quality of embryos and how skillfully the biopsy was performed, not just the sample size. This research is important for patients and fertility specialists. It reassures patients that undergoing genetic testing of embryos does not reduce the chance of success and that damage to embryos is extremely low. For clinics, it means to focus on the best practice of having the most senior people biopsying embryos with greatest skill. Some limitations do exist. It comes from a single high-level center, and as we get more and more data, we will be able to understand the risks and the benefits. Overall, this study supports that if you were to biopsy embryos, it does not seem to harm them in any way, and pregnancy rates are maintained.